If you look at your expenses, rent used to be the number one expenditure. Now it's probably vaccines that have exceeded that. So you're tying up so much revenue, so much of your practice expenses into vaccines. Why shouldn't you expect to be compensated for this, having the ability to store the vaccine for the patient that needs it? They are just whittling you down to whatever cost it is for the vaccine and not realizing how much time it takes for a nurse to draw up the vaccine, the alcohol, the Band-Aids, the whole thing. And they say, oh, that's a part of the administration cost. The administration costs don't cover those expenses, especially when you start factoring in the time it takes to interface with the registry and report this and provide the patient counseling and everything else. It just doesn't add up.
Correct. So I've heard from what I used to think was a good insurance company. Now I think very poorly of them. That's okay. Physicians don't need to make money on vaccines. And it's not about making money, is what you said. There's a cost to that investment that I need to recoup. In Virginia, there is a Medicaid plan for people that are over the Medicaid threshold. And so it runs a little bit differently. So they're not eligible for VFC vaccines. And the state pays for those vaccines as if it was a private payer. And they pay below CDC cost in what you can buy the vaccines in the market, and they don't pay the admin fee. So you see the patient and then you send them to the health department to get the shot, because otherwise you're on a $300 vaccine. They pay you $30 under, and the physical is $70. You're way underwater now.
Yeah.
And what's interesting, I had the staff call the health department because this clinic honestly cannot afford to buy $5,000 worth of Beyfortus to have it sit in the refrigerator, so that if they get audited by BFC, they show that they have the same vaccines in the commercial refrigerator than they do in the Medicaid refrigerator. So I called to see if we could send the high-risk kids over to the health department. And their answer is like, oh, we don't buy that kind of vaccine. That's too expensive. And so my question is, I don't know. I have tremendous respect for you and Dr. Kane and Dr. Birch. Why we're still short? Let everybody be on VFC. No, take that monkey off my back.
Vaccines should be a universal thing where you're paid according to again, that requires a legislative action. Vaccines shouldn't become a profit center for a practice, and it shouldn't be a loss center either.
But why not everybody on VSC? What would be the regional objection to that?
There is no objection. The states would have to absorb the cost, and they won't.
Not necessarily. So Idaho's done it. And Rhode Island has done it. And what they have done is they put a tax on the health insurance premiums. And so that's how it gets funded. And so it's budget neutral for the state, but no longer is the health department or the physicians burdened with the tremendous cost of vaccinating society, because it's not our cost to bear.
No, it shouldn't be. It shouldn't be. Again, you're getting into an area where you're starting. Again, this is an area that the AMA would say is socialized medicine, which is inappropriate terminology. The same things were said when Medicare and Medicaid were first promoted back 50, 60 years ago. It's crazy. Vaccines should be something that is covered by the government and not a income generating center, but at least to cover the cost of administering it. And if you are going to be forced to store it, you still need to have that expense added into the administration expense. Of course,
because they come and audit you. You have to file reports. You have to have a backup generator. You have to measure the temperature in the refrigerator. It's not like they give it to you to hold in the refrigerator and you're like, we're done.
and then they penalize you if something goes wrong.
Yes.
That's the other thing. And the VFC programs at least in New Jersey, have been more punitive than educational. They do anything possible to make things more difficult for you, even if you have the most sophisticated refrigeration system and temperature logging. Disasters happen, power failures happen. And even with that, you're at their mercy. If something goes wrong, they hold you financially responsible.